Good nutrition is really fundamental across the lifespan. It's important that women enter pregnancy in a good nutritional state. The period in the first year of life is really fundamentally important for good nutrition. Babies will do better if they're exclusively breastfed for 6 months or for as long as mums can during that period, and have appropriate complementary foods in the second 6 months of life, which are really going to help them develop their chewing ability, their like of different range of foods, and also going to make sure they don't grow too quickly, because babies that become obese in the first year of life are much more likely to become obese children and then obese adults. And that is a huge cost to their health and well-being for the rest of their lives. It's much easier to act in advance to try and save cost of treating what can be very costly illnesses and lifelong problems. So it's really fundamentally important that health visitors are supported in those areas where they can really make an impact on family health to prevent some of those later cost implications to the NHS. There's a lot of concern about obesity costs because of the number of health problems that can go along with overweight and obesity, both in childhood and later life. And that alone is a good measure of just how much impact health visitors can have on cost savings for the NHS. One of the other things that's unique about health visiting is that you are there for the whole family, and there are opportunities to support other members about healthy eating and nutrition from the information that health visitors have. And that may be an older person within the family, or it may be another family member. And I think that's a very unique thing about health visiting. Training health visitors in preventing some of those illnesses and diseases that may go alongside poor nutrition in the first years of life is going to be a real cost saving to the NHS. We know that prevention is important. Once diseases are established and once children are overweight and obese, we then have to treat those things. It's much, much better if we can get in early, prevent them, and ensure that everybody does better in the long run. Training health visitors is really fundamental if we're going to make some cost savings to the NHS in the long term. Everybody understands that prevention is better than treatment and will save us money, and also save a lot of ill health and poor well-being in our population. So ensuring that health visitors have the skills and the understanding to make those changes is really important. One of the key things that health visitors need to know from their training is where to go to access the latest information and sources of toolkits for advice that they can give to families around good nutrition and healthy eating and well-being and exercise in the first 5 years of life. And I think having that good knowledge of where to go and how to use that information is really key if we're going to make a difference.